I'm Michelle. We have the 10th cranial nerve, which is the vagus nerve. The vagus nerve is considered a mixed nerve as it contains both sensory and motor fibers. The vagus nerve is the only nerve in the body, the only cranial nerve in the body that extends past the head and the neck and reaches other parts of the body. So the vagus nerve originates in the medulla between the pyramid and the inferior cerebral peduncles. It extends to the jugular foramen, which is going to be at the bottom of the skull here, and extends down the neck, more specifically through the larynx and the pharynx, to the thorax and abdomen. It contributes to the innervation of the viscera that reaches all the way down to the colon. So if we started here, reach the larynx and the pharynx, down through the digestive tract, all the way down into the colon. So the vagus nerve contains both somatic and visceral afferent fibers, as well as specific and general efferent fibers. This comprises about 80 to 90% of the afferent nerves, mostly conveying sensory information about the body's organs back up to the central nervous system in the brain. Alright, so there's two parts to the vagus nerve. We have the right vagus nerve and the left vagus nerve. The right vagus nerve gives rise to the right recurrent laryngeal nerve, which hooks around the right subclavian artery and ascends into the neck between the trachea and the esophagus. The right vagus then crosses anterior to the right subclavian artery, runs posterior to the superior vena cava in the heart, and descends posterior to the right main bronchus and contributes to the cardiac plexus, esophageal plexus, and the pulmonary plexus. And then we have the left vagus nerve on this side, and it enters the thorax between the left common carotid artery and the left subclavian artery, and descends on the aortic arch. This gives rise to the left recurrent laryngeal nerve, which hooks around the aortic arch to the trachea and the esophagus. The left vagus nerve further gives off to the thoracic cardiac branches, breaks up into the esophageal plexus, and enters the abdomen as the anterior vagal trunk and the esophageal hiatus of the diaphragm, which would be here. Next, we're going to be talking about the function of the vagus nerve.
I'm Kathy, and I'm going to be talking about the function of the vagus nerve today. As Michelle noted, it has motor and sensory functions, so it sends motor and sensory signals that link the heart, the lungs, and the digestive system to the brain. So I made some bullet points here just to kind of make it easy for you. So some of the main functions of the vagus nerve is it innervates the larynx, pharynx, and the viscera and the thorax and the abdomen. It also regulates our swallowing and our speech. It also has a lot of functions in the parasympathetic nervous system. So it stimulates smooth muscle contractions and secretions for glands in the organs. That includes your pharynx, your larynx, and your thorax and the abdomen. So some of the specific things that it does is it decreases heart rate, it constricts the bronchi and the lungs, and it also increases digestive activity. So one of the main things that people think of with the vagus nerve is that it affects your reflexes for gagging and swallowing. Via efferent signals, the pharyngeal muscles will contract when the pharynx is touched, causing the gag reflex. You can probably all relate to that if you've been to the doctor's office for a strep test. With swallowing, the soft palate moves and the pharyngeal muscles will contract when food touches the entrance of the pharynx. And that is some of the motor and sensory functions of the vagus. Next, we're going to be talking about the pathology and testing for the vagus nerve.
And I'm going to be talking about the problems associated with damages to the vagus nerve. The damages can have a range of symptoms because the nerve is so long and can affect so many areas of the body, like Michelle pointed out in her part. These damages can cause difficulty speaking or loss of voice, a voice that is hoarse or wheezy, trouble drinking liquids, a loss of gag reflex, unusual heart rate, abnormal blood pressure, decreased production of stomach acid, nausea or vomiting, and abdominal bloating or pain. The symptoms someone might have depends on what part of the vagus nerve is damaged. Experts believe that damage to the vagus nerve may also cause a condition called gastroparesis. This condition affects the involuntary contractions of the digestive system, which prevents the stomach from properly emptying. Symptoms of gastroparesis may include nausea or vomiting, especially vomiting undigested food hours after eating, loss of appetite or feeling full shortly after starting a meal, acid reflux, abdominal pain or bloating, unexplained weight loss, and fluctuation in blood sugar. Some people develop gastroparesis after undergoing a vagotomy procedure. which removes all or part of the vagus nerve. The vagus nerve helps maintain the complex processes in your digestive tract, including signaling muscles in your stomach to contract and push food into the small intestine. So a damaged vagus nerve can't send signals normally to your stomach muscles, which would cause food to remain in your stomach longer rather than move the food to the small intestine to be digested. The vagus nerve can be damaged by diseases such as diabetes or by surgery to the stomach or small intestine. As for testing the vagus nerve, a doctor may check the gag reflex. During this part of the examination, the doctor may use a soft cotton swab to tickle the back of the throat on both sides, and this should cause the person to gag. If the person doesn't gag, this may be due to a problem with the vagus nerve. The vagus nerve is usually tested together with the glossopharyngeal and the hypoglossal nerves, which is cranial nerve 9 and 12 respectively. You would instruct the patient to say ah and assess the soft and hard palates, uvula, tongue, looking for any signs of deviation or asymmetries. So now I'm going to be testing the vagus nerve, and like I mentioned before, you would test the gag reflex. So I'll be testing it on my willing participant, Kathy. So the patient will be instructed to open their mouth and say ah, ah, and I'm going to stick this in. And as you saw, her gag reflex is fine, so she has no problems with her vagus nerve. If she did, then she wouldn't gag at all. And remember, kids, what happens in Vegas doesn't always stay in Vegas.